All right, thank you to both speakers. So if you'll load up the video, this is an interview of a patient's mother who's has a 15-year-old healthy kid, and
he wants to continue, but he's
if you can turn up the audio.
Intermittent sharp pain that he has on his from a reducible inguinal hernia. At this point, you and your son have expressed an interest to go hernia repair, so I thought we'd talk a little bit more about it. Are you aware of the different options for inguinal hernia repair?
Yeah, I know there are several different options for repair. But I think what I need is a little more information about the different operations. And I have a little bit of concerns about the mesh that's used that I've seen on some TV commercials.
What's your concern specifically about mesh?
Well, I've heard from some people that kids can have pain or adults can have pain from mesh. I've also heard that they can get an infection. So my biggest concerns were the pain and the infection risk from having mesh.
I see. So if I were to tell you that mesh has a very low risk of infection overall and has a low risk of hernia recurrence, would that change your mind to some degree, or are you still concerned about it?
No, I think I still have some concerns just because there is information out there that tells you that, you know, in a small percent of patients they can have like chronic growing pain.
So what would push you to choose one type of a repair for your son over another?
Well, I think that, you know, you have to weigh the pros and the cons. I certainly wouldn't want his hernia to come back, and if I chose not to use mesh, I know that's a risk that in a couple of years he might develop a hernia again because he is a very active 15-year-old. My concerns with the mesh is, what do we do if he ends up having chronic growing pain? Then what are the options? Do we end up having to take the mesh out anyway, and then he gets a recurrence, but he's had to have 2 operations instead of just one, with the risk that he won't have a recurrence?
Sure, that makes sense.
So I think that's something I need guidance from you in. It's a decision that I want to make sure that I make the right one for my son, and it's kind of a hard decision.
So the sort of conclusion to that video, obviously she poses more questions than we give answers in the video, but it's questions that, you know, we as adult hernia surgeons face all the time. And as Todd highlighted, as you push that envelope further and further back into adolescence, at some point there's an inflection where your answers to those questions may be very different, and you may say, you know, mesh is not indicated here, the recurrence rates are quite low. Todd said 1.2%, and it's advisable to steer clear of mesh. And as we push that envelope up toward those inflection points that Todd highlighted, we may counsel them otherwise. So it's great to see some of that data with regard to the inflection point where we may transition from a pediatric surgeon to adult surgeon, or whatever you want to call it. But those are questions that patients often raise.